Welcome to Pronger Smith Medical Care, where patient safety and quality of care are very important to us. At Pronger Smith, our mission to deliver safe, quality care begins and ends with meeting the needs and expectations of our patients. Pronger Smith Medical Care is the premier healthcare facility of Chicago's southwestern suburbs. We have over 50 doctors, state-of-the-art technologies, highly trained staff, and are Joint Commission accredited. Our healthcare professionals are very friendly, open, and always encourage an honest dialogue with patients and family to assure the best possible care. Pronger Smith Medical works with diabetes patients of all types with a team approach to achieve the best outcomes. We offer a team of healthcare professionals which include board-certified physicians, certified diabetes nurse educators, dietitians, pharmacists, and care coordinators who will give you the support and tools necessary to self-manage your diabetes. We work with you to develop skills that you may need to better manage your diabetes and prevent complications from occurring. Diabetes. It's time we changed the statistics, one patient at a time. Type 2 diabetes is disease that has manifested itself in America in the past 2 decades as the leading #1 preventable disease. Diabetic complications include heart disease and stroke, high blood pressure, kidney disease and renal failure, neuropathy or nerve disease, and amputation. Over 25 million adults and children have diabetes. There are 7 million more undiagnosed who have no idea they have it. Over 25% of all people over the age of 65 have been diagnosed with diabetes. And then there is the scariest number of all. 79 million people have prediabetes. What is prediabetes? Well, prediabetes is when a person's blood glucose levels are higher than normal, but not high enough to be type 2 diabetes. People with prediabetes are more likely to develop type 2 diabetes and may have some problems from diabetes already. If you have prediabetes, research shows that you can lower your risk for type 2 diabetes by 58% by losing 7% of your body weight or 15 pounds if you weigh 200 pounds. Exercising moderately, such as brisk walking, about 30 minutes a day, 5 days a week. So it is very preventable. Healthier diets and exercise, coupled with no smoking, are the life changes needed for diabetics. Even those that appear healthy can always benefit from the following advice.
Hi, I'm Dr. Bolasay. I'm an endocrinologist here at Pronger Smith. I've been here for 7 years. Endocrinology is the study of hormones and diabetes. First of all, I love the way the body works. I love physiology and studying mechanisms by how the body responds to various things. And endocrinology encompasses all of that. And in addition, it involves studying hormones which have effects both near and far in the body. And I find that very fascinating. Diabetes has been on the rise in the United States mainly because of changes in the way we live. we have a problem where we tend to eat unhealthy choices that leads to increase in weight, and we tend to be more sedentary. So all those factors come together in this day and age to cause a problem where we have a higher incidence of obesity, and those people are at risk to develop diabetes.
So when I see a patient, depending on their profile, let's say depending on their weight, family history, I would always like to screen them for diabetes, especially if there's a family history involved, or if the patient comes and says that I am having too many episodes of thirst and urination, or I'm losing a lot of weight and I'm not trying. So we always start off screening them for diabetes. And that can happen through blood work. There are several blood work that can tell me if the patient is diabetic or pre-diabetic. And then if they're in a full-blown diabetic stage, then we have to start becoming very proactive by medication and lifestyle changes, diet, diabetic teaching that we are very big on at Punger-Smith. If we catch them in a pre-diabetic state, then that's a good timing because they can do lifestyle modification, and hopefully they will not get to that full-blown state.
Type 1 diabetes is where the organ in the body called the pancreas doesn't produce any insulin at all. Insulin is a hormone produced by this organ called the pancreas. In type 2 diabetes, it's different because the pancreas can either not produce enough insulin or the body cannot respond to the insulin properly, and or both.
Foods that I recommend diabetics to eat are those that are low in carbohydrates. It's generally better to eat whole grains. Whole grains are complex carbohydrates. It's better to stay away from what we call the white carbs, white, flour, sugar. Those are foods that they should stay away from. A diet high in antioxidants is helpful to prevent heart disease, and so that would be especially important in diabetics.
Okay.
There are several resources available at the clinic. One of them is our dietitian. So we frequently try to enroll our patients with the dietitian to help with efforts at weight loss. We also talk to them a lot about the importance of trying to establish some type of cardiovascular exercise program. And that can really vary depending on the needs and the abilities of the patient. I think, recommendations for women for a healthy lifestyle vary with age, but I think the key factors are, number one, staying active, incorporating some type of cardiovascular exercise into your routine, and a goal would be 5 days a week. I think, in women in their 20s, you probably focus more on, avoiding smoking, avoiding drug use, avoiding the sun, sunscreen use, things like that. Women in their 30s and 40s, similar, but exercise as well is something that's stressed a lot. As women get into their 50s and 60s, more preventative screenings such as regular mammograms, screening colonoscopies, that's a focus as well. But again, staying fit is a top priority for all women.
I think one of the problems with obesity is the fast food. And because it's very convenient, cost-wise, it can be a little more affordable. So, but I think there are a lot of hidden calories, sugar, fat in fast food. So that's the first thing I recommend to my patients to maybe limit that, and because it will facilitate with their, with their feeling better, and especially sugar is a huge problem, I think, in our society, especially sodas, pop, and a lot of people don't like drinking water. So when I encourage them to switch to water, less sugar, they come back and give me the feedback how much better they feel. So I think that's very important.
Listen close to what Dr. Kaplan has to say. Diabetes can and does cause blindness, but it doesn't have to.
Diabetes is the leading cause of blindness in this country. Fortunately, this is usually preventable. All diabetic patients should get a complete eye exam at least once a year with an ophthalmologist. Unfortunately, the damage that diabetes does to an eye will not cause symptoms until it's very far advanced, so patients won't know there's a problem until it's too late. We also work carefully with the patient's primary care physician to help to make sure that their blood pressure and blood sugar are under good control. In addition, cholesterol needs to be well controlled as well.
Dr. Fahey continues on with more helpful information. Diabetes control aids in less irreversible nerve damage.
A neurologist will see a diabetic most typically for the development of a polyneuropathy, which is just a general term meaning a problem with the nerves that can typically present with feelings of numbness, tingling, or burning in the lower extremities. The best treatment for a diabetic polyneuropathy